Hello, my name is Robert Martiniano. I'm the Senior Program Manager at the Center for Health Workforce Studies. Today, I want to use the incidence of asthma by geography and by age to demonstrate the functionality of the data guide. As we think about asthma, we know that the causes do vary geographically and by age. In older populations, especially in rural areas, smoking may be more of a cause. Also in rural areas, occupations may have a stronger link or association to asthma than in urban areas. And finally, in urban areas, air pollution, rodents, and cockroaches have a strong association with asthma. To explore this issue more fully, let's define our research question first. Simply put, are there geographic and age differences in asthma rates? Additionally, we also want to understand how the prevalence of asthma may impact on asthma hospitalization or asthma ED visits. For this case, we are going to compare New York City to Clinton County and to the North Country region. First, we need to review the geography of New York State. Clinton County is on the border of Canada, and the northern border of New York City is about 4 hours south of Clinton County. So there's some geographic differences. Let's start by taking a regional view of the data. When you first get into the data guide, it starts at a region at a glance. As you see, these regional views give basic information on the region, supported by some narrative on the right side of the page. When you scroll down on this page, you will see other data that can also be reviewed, such as information on education, natality, health status and behaviors, hospitalizations, health occupations, and employment. Notice that on this page, the data is presented in both a table and graph form. So now let's go back to the top of the page. In the upper left-hand corner of the map, you will see a select box with the word capital in it. Use this select box to navigate between the regions. So let's start our analysis by going to the New York City region. In New York City, we see a high percentage of Medicaid-enrolled individuals. Additionally, we see a brief comment in the narrative about respiratory disease. And then when we click on the details, asthma comes up as a significant issue. The narrative highlights both ED visits and hospitalizations, but let's first look at incidence of asthma in New York City. We will go back to asthma ED visits later. First, we will start by selecting health status and health behaviors. This view of the indicators compare them regionally to downstate New York, to upstate New York, and to the state as a whole. As you can see from the chart and the graph, the percentage of the population with asthma in New York City is lower than in upstate New York and the state as a whole, but slightly higher than downstate. Normally, we would do a more in-depth analysis by county. However, health status information taken from the Behavioral Risk Factor Surveillance Survey, or BRFIS, is only available for New York City as a whole, not for the individual counties within New York City. Consequently, we can only compare initially to other regions. So now let's go back and look at asthma rates in adults in the North Country. By just selecting the North Country, we can see the percentage of adults with asthma. But let's go a little deeper. To do this, we need to go into the detailed view. Since the detailed view starts at the state level, we will need to select the North Country region. As you can see, there are boxes in the upper left-hand corner that allow you to select the region or the county. This view gives us the number of individuals with asthma, the percent of individuals with asthma, and any change in these percentages from the previous cycle's data. Using the same screen, we can see the detailed view for all regions. Selecting details from the right-hand side of the page, we see that the North Country has the highest rate of asthma for adults, while New York City has one of the lowest rates. In comparison, approximately 13% of the North Country adult population has asthma, higher than the New York City's percentage of 10%. While the percentage of adults with asthma in New York City counties is not broken out, we can, however, see it at a county level in the North Country. So let's look at Clinton County. From the detailed view, rather than the regional view, we can select Clinton County. As you see, 16% of Clinton County's adult population has been diagnosed with asthma, higher than both the North Country and the New York City regions. By selecting details, we can see all counties. The heat map on the lower right-hand corner shows that Clinton County has one of the highest rates of adults with asthma, along with a number of other upstate counties. Or we can just select the North Country and see those counties. As you see, Clinton County has the highest percentage of adults with asthma in the North Country. As you may remember, our initial research question also asked about the impact of asthma on ED visits. So let's look at asthma ED visits for children ages 0 to 17. To start, we need to go back to the detailed view, then click on Asthma ED Visits 0 to 17. Since we are already in Clinton County, it displayed Asthma ED for that county. Again, by clicking on the details text on the right-hand side of the page, as with the percentage of adults with asthma, we can see Asthma ED visits for those children 0 to 17 by county. And as you can see, the number and rate of asthma ED visits in the Bronx is significantly higher than in the other counties displayed. So let's start this part of the analysis by looking at New York City as a whole. Since we can take a regional view from this screen, let's look at asthma ED visits for children ages 0 to 17 for all counties in New York City. While BRFIS does not report health status and health behaviors by New York City County, other variables such as hospitalizations, ED visits, mortality, and demographics are all available at the county level. As you can see, Bronx has a significantly higher rate of asthma ED visits for children 0 to 17 than the other counties in the region. We have looked at the prevalence of adults with asthma and asthma ED visits for children who are 0 to 17. Another step could be assessing the age distribution of a population within our two counties, Clinton and Bronx counties. To start, we need to go to the detailed view. Then select General, then Demographics. As you can see, over 24% of Bronx's population is under the age of 18. The high percentage of the population under 18 and the high rate of ED visits for children 0 to 17 probably means that this issue is not going away soon. Can we say the same thing about Clinton County? By selecting Clinton County in the county box, we see that slightly less than 19% of the population is under the age of 18. As you may remember, however, Clinton County has a higher rate of adults with asthma than other counties within their region and statewide. Most likely, we need to consider healthcare solutions that start with children and extend into adulthood. As you think about the data available on the data guide, remember that data is not always available for certain counties, such as the incidence of asthma in adults in New York City counties. While the data guide is a good starting point to understand asthma in New York State, further research is needed to better understand other potential causes.